Hello, my name is Dr. Delasy Gbekor. I am a medical officer with Landmark Healthcare. May is Mental Health Awareness Month. So today I'll be talking to you about mental health disorders. The World Health Organization defines mental health as the state of well-being in which an individual realizes his or her abilities and is able to cope with the normal stresses of life, and then can also be productive at work and is able to contribute to his or her community. The mental disorder we're talking about a disturbance in how people think, that's the cognition medically, or how people regulate their emotions, how they control their feelings and how they behave, and there's always an underlying psychological, or we'll say a biological phenomenon responsible for this. Biological in the sense that there's probably a medical condition that predisposes them to the mental health disorder. So the causes of mental health disorders, there are quite a number. I'll just mention a few. We have the genetic causes. So that's when you inherit a mental disorder from a family member. We also have medical conditions. An example is the people who've had a stroke. They can develop something called dementia. We also have medical conditions that can be transferred from the mother to the child, maybe when the child is in utero or is still in the mother's womb. So certain infections, viral infections, or certain chemicals that the mother ingests can affect the baby, and then long term, the baby can develop mental health disorder. There's also the issue with childhood trauma, where children probably, as a result of separation or divorce of both parents, develop one mental health disorder or the other. There's also trauma, probably from sports injury to the head, or an accident whilst traveling by a road. These are just some examples of causes of mental health disorders. When it comes to categories, we have quite a number as well. We have something like psychotic disorders, we have personality disorders, we have mood disorders, we have substance abuse. Sometimes there's an interplay. You see, people might exhibit features of two or more mental disorders. Yes, so that's when we have subtypes or different subcategories, within these major groups. I don't know the current statistics, but in recent years we have seen most of the mental health disorders relating to schizophrenia, which is a type of psychotic disorder, depression, that falls under the mood disorder, and then substance abuse. It depends on the kind of mental health disorder you're dealing with. So for example, if it's psychotic like schizophrenia, then there are certain symptoms you see, positive and negative symptoms. That's how we define the features for schizophrenia. Some of the positive symptoms, patients will hallucinate, or will have disorganized speech. When negative symptoms show some kind of apathy. If it's depression, it's typically associated with sometimes dietary change. The person might have suicidal thoughts, and so on and so forth. So it depends on the type of mental health disorder they're dealing with. You don't have symptoms that are shared in common with all the categories of mental health disorders. So you take a history, you examine the patient, it's a physical exam, because you want to make sure there's no organic cause for the disease. So for example, earlier on I spoke about stroke and how certain individuals who have a stroke might start exhibiting something called dementia. So dementia comes with a number of symptoms or signs. And sometimes the person's behavior changes, the mood changes, and it's because of the stroke, okay, that predisposes the person to dementia, for example. So it's always good to find out if there's an underlying medical condition. If after doing all your checks you do not find any, then you recommend a psychiatrist. And in psychiatry, there is a manual that is used to diagnose these psychiatric or mental health disorders. It's called the Diagnostic Statistical Manual for Mental Disorders. And the current version is version 5. Yes, so it's used in the diagnosis and assessment of mental health disorders, but not treatment. No, mental health disorders typically are not curable, but are treatable. Yes, with side effects, okay, depending on the type of medication you use to treat, yes, there are a number of side effects. But a few side effects that you might have cutting across, you have nausea, vomiting, change in eating habits. So some might eat too much or eat very little. You might also have anxiety building up, and then weight gain. You can have weight gain in some of these as one of the side effects of some of these drugs. There are quite a number of high-risk groups. So we can look at people in certain situations. So if we are to look at our setting, or globally, let's say people who are constantly under stress. So even doctors, people who are constantly under stress, people who experience some form of violence, so domestic abuse, for example, people who are incarcerated, prisoners, people who are on the streets, okay, and then outside we have the refugee situation. Yeah, so these are some of the groups that are at high risk of developing mental health disorder. We could also include people that resort to recreational use of drugs or alcohol. Yes, that's another group. There is something called senile dementia. Okay, that's as a result of age. So unlike what you get in a stroke, which is called vascular dementia, senile dementia is just due to aging, the aging process. They tend to become forgetful. They are unable to keep track of events. They become moody. Sometimes they cry, don't want to talk to anyone. Yeah. There is some evidence that some mental health disorders can be transmitted. In my clinical practice, there's been situations where, for example, a psychotic disorder like schizophrenia, a family, I think the mother had schizophrenia, and then subsequently one of the children also developed schizophrenia. So there is that possibility. Unfortunately, no. It's very, clinically I've not really seen any case where there's like a strong family history of mental health disorder not being passed on. Yes. So can't be prevented, but can be controlled, or as I said earlier, can be treated. With that, there's the medical side to this, and then there is what the individual can do in his or her own time and space. Medically, especially if there's a strong family history, it's recommended that you see a doctor, preferably a psychiatrist, who can do extensive follow-ups from time to time. And when it comes to things to do as an individual, I think the basic stuff, making sure you have the right diet, you exercise, you engage yourself in activity, especially when you have negative thoughts. It's good to always have a support group or friends who can, or who you can rely on, you can talk to every now and then. You can engage in, especially for those who are very stressed out, you can engage in activities. Some people like yoga, some listen to music like I do. Some people do very interesting things, learn to play an instrument, watch cartoons, I've seen that. Some help kids like to throw all their energy and time into helping kids out in orphanages. So I think these are some of the things that can help. Management of these mental health disorders is always multidisciplinary. So apart from the medical side, there are various groups. So like you mentioned, family and other support groups. So the church can come in, right? Outside, they have so many support groups that are able to reach out and then help the members. So I think family needs education on these mental health disorders, because the main problem is the stigma. Okay, in Ghana, it's either stigma or superstition. People think it's because of witchcraft or some black magic from a family member somewhere. So I think it's best to make sure the family is educated, okay, and you let them understand that it's not the individual's fault. It's just something that has gone wrong and can be treated. What's very important is love, to show love regardless of how different the person is, and to be patient. But some of these treatments take some time for you to measure progress. The church can play its role. I'm not doubting the power of prayer. Yes, so the church or mosque, any religious organization the individual belongs to, can also help. And then just a small circle of friends, or maybe creating support groups, to help. I know there are some people that try to create support groups for people with depression. Yeah, so, and then they have like something like a buddy system. So if a member feels like, okay, I want to kill myself today, there's always someone who calls in to check, or the person who feels like committing suicide can actually call and tell the person, I feel like taking my life. Then quickly they find a way to either meet, or there's a system in place where they talk to get the person's mind off. Yes. So we can talk about dangers to the individual, right? Dangers to others, and then everything else around the individual. So, like I mentioned earlier, the risk of suicide is really a thing. In my years of practice, I've seen quite a number of people attempt. Some were able to revive, some unfortunately lost. That also does damage to the family. The family is also stressed. Sometimes they get violent depending on the particular mental health disorder, and they might hurt a family member or a friend, you see. They also have issues at work because they're unable to work with other people. They are unable to finish projects, and there's also the financial bit we should look at, because it's a long-term treatment, constantly going to the hospital, spending lots of money on medications, seeing one specialist after the other. Yes, this apart from dangers, these are some of the implications. And there's also the legal bit. Imagine someone who is supposed to do a particular job, and because of one mental health situation doesn't do as maybe the contract states, gets into trouble. These are some of the things we have to look at. So these are the implications, but the dangers usually is self-inflicting injury, like the suicidal ideations, or being aggressive towards someone else. Mental health in Ghana is growing, fortunately. Previously, we're not getting a lot of data concerning cases of mental health disorders. Another thing was the stigma attached. Okay, that wasn't very helpful. But we're in an age where we're dealing with a lot of people going through negative thoughts, emotions. So I could use the COVID situation, for example. It's had such a global impact. People have lost their jobs. People have lost loved ones. So one of the mental health disorders that is really common is depression. There's depression, there's anxiety, which is also a special category of mental health illness. Depression and anxiety are really in the system because of this pandemic. So there's the growing need to be able to create an awareness for mental health illness. We have to eliminate the stigma. We have to embrace these people because they're just like you or me. We need to embrace them. We need to show love, support. And I believe as a nation we can progress in how we understand these mental health disorders and ways of helping people suffering from these conditions. If you have a relative, or if you yourself think that you are suffering from a particular mental health disorder, don't be ashamed to reach out for help. There are health professionals ready to assist. There are various organizations, NGOs that are ready to come to your aid. It's always good to see a general practitioner who will then assess your affair. Okay, I believe there are some support groups. I'm sure if you go online, you see quite a number of them. They are not very well established in Ghana, but outside I know they have quite a lot of support groups. In this month of mental health awareness, let's take an opportunity to evaluate ourselves and reach out for help when we need to.